Welcome to the Health Channel, all health, all the time. I'm Olga Villaverde, coming to you from the Baptist Health South Florida studios. Without proper sleep, we cannot concentrate, create new memories, or even function. Making sleep is really important for even daily nutrients as well. So joining us to talk about sleep health is Dr. Carlos Ramirez-Mejia, a neurologist at the Baptist Health Neuroscience Center. Welcome, doctor.
Thank you.
Thank you for being here.
Well, thank you for inviting me.
Talk about the connection first, doctor, between sleep health and neurology as well.
Yeah. The sleep is important for every organ in your body, for the kidneys, for the liver, for the lungs, but it is more critical for the brain. The brain, it needs to sleep, needs to rest at night. And there are a lot of activities that are happening in the brain during the night. For example, we process memory. The brain takes all the pieces of information during the day, classifies it, and stores it. It decides what information needs to be kept, what information is not needed. So if we don't sleep well, our brain is going to be impaired, not only because he has all this work that he didn't do the night before that was supposed to be processing of memory and some other brain functions, but he has to do the activities of the day, and he's going to do it under stress. So the organ that benefits the most from sleep is the brain, and that's the one that gives us who we are. Almost every single organ in the body has one role, and is to keep the brain going and to keep the brain protected.
Because it is the control center of our body, right? I always equate it like to the nucleus of the cells. It is like the control center.
It's our identity, is who we are. So the purpose of every single organ is to keep that organ healthy.
All right, and sleep is connected to so many aspects of our health. We have a few examples. Let's walk through these, doctor, and talk about how important they are. Sleep benefits our physical health. I mean, that's just a no-brainer, no pun intended. Mental health as well.
Yes. During sleep, we process not only memory and cognition, but we process emotions. And that's what we have nightmares and we have dreams, is that we are putting together our emotional state with memories and we store them. So sleep is critical for the management of anxiety and for even depression. When you don't sleep well, the chemicals that are needed for the optimal functioning of the intellectual and emotional aspect of the brain are decreased. And so it's sad that if you don't sleep well, you don't produce certain chemicals, so you take a medication to increase those chemicals instead of sleeping better.
Exactly. So you mean chemicals like norepinephrine, serotonin, dopamine.
So you take medication.
So we're taking medication to replenish that.
Instead of getting them naturally.
Sleeping.
Sleeping, exactly. Because the society has made heroes of people that don't sleep. People tend to say, like, I am so successful, I can barely sleep, or I was studying all night and I only slept for 4 hours.
Right, and they tout it as good.
They seem to be, like, proud of it.
And it's not good.
It's not.
It's not good at all. The last one there was personal and public safety. What does that mean, doctor?
Okay. When you look at all these big tragedies, for example, remember in Alaska, we have the big accident when there was a carrier of petroleum and there was an accident, the Valdez spill.
Exxon Valdez.
Exxon Valdez.
Yes.
This man actually was sleep deprived, and he couldn't stay awake, and that's the reason why this happened. We think that about 10 to 15% of the accidents are due to people that are falling asleep.
And how many car accidents as well, which is just so prevalent.
And it's so difficult to determine many times because there are so many people that are sleep deprived, and to make the connection sometimes is difficult unless they recognize that they fell asleep.
Exactly.
But it's a serious problem.
It's a very serious problem.
All this, when you look in television, when you're watching television and they said there was this collision of 2 trains and there are a lot of people dead, probably 80% of the times is because the drivers fell asleep. They were not awake during the time of the accident.
I grew up with a family that lived close to us. It was such a tragic story. You just brought it up. The father fell asleep on the turnpike, and it was a head-on collision, and he lost his 3 children. It was just absolutely awful. And that's really just a tragic, tragic story. But it can happen. And it's because we're not sleeping enough and our bodies need it. So doctor, what is happening in our body when we sleep?
Okay, the first thing that happens when, let me tell you about the preparation of sleep.
Okay.
Just think about this. Going to sleep is the same for every single animal. So the fact that we are humans and we think they are very sophisticated and very evolved is not really true when we talk about sleep. We are as primitive in the sleep function as any animal.
Okay.
What happens when animals are going to sleep? The light decreases because the sun, there's not much sunlight. The temperature goes down. The sounds in the environment decrease. Mm-hmm. And the stimulation in general is less. We don't do that anymore because we prolong and extend our lives through the night. So we have artificial lights, we have television, we have all these things. So we disrupted that system. So what we need to do to sleep well, we need to recreate those natural elements. For example, you decrease the lights in your apartment. You dim them when you have preparation for sleep. Mm-hmm. You turn down the sounds. So you're mimicking what happens in nature.
Exactly.
Then you go into your decreased level of activity. You don't, for example, don't watch like your iPads or all of that.
You shouldn't be.
Because every time you look at your iPad, the brain gets the message that it's noon, mm-hmm. because of the kind of light that is coming. Mm-hmm. So you lower the temperature. You go into the air conditioner and you put the temperature to the lowest that you can stand. So all that is mimicking what happens in nature, but you are doing it in your apartment.
Or in your home.
So then you go to sleep. When you go to sleep, you go through different stages, and those are very critical. One is in a stage when the brain goes into some form of like rest, becomes very slow, and all your organs slow down, your heart rate. Every organ goes into the rest and test mode. Your muscles relax, everything. And later on, like about 45 minutes later, you go into this increased brain activity, which is almost similar to when you are awake. And in that period is when you start dreaming, you process memory, and the brain is as active. If I look at an EEG, for example, the test to measure the brain activity of somebody in that stage, it's very difficult to tell if the person is awake or is asleep because it is as active. And you go through those cycles to the night. So you are resting, you are testing your different systems, and you are processing memory and emotions. So it is critical.
It's fascinating.
And fascinating.
Let's show our viewers, it's kind of like a picture of when we're born all the way to when we get older in terms of the amount of sleep that we need over time. So obviously when you're a baby, 12 to 16 hours, we know babies sleep a lot, and then it changes. Doctor, chime in on those.
Yes, this is very interesting because these are like average numbers, but everybody's different. And we are born with a different number of hours that is required for us to function optimally.
So a different body clock, if you will?
So what happens is, for example, there are individuals that need only 4 hours. That's a minority, but they are out there. And that's the person that comes to see me to the office that says, I go to bed like at 10, and 4 hours later I am up, but everybody's asleep. I don't need more sleep. I am not tired, but I think I have a problem.
Yeah.
And that person doesn't have a problem.
Right.
He only needs 4 hours, or she needs 4 hours, which is a minority. And I have another group of people that said I sleep 8 hours, and I'm still tired. If they don't have another medical problem, it's probably that they need 10,
yeah,
or they need 12. Those are the two at the end of the spectrum. The majority of people will go from 6 to 8.
6 to 8 is the normal.
As an adult.
Okay.
But as children, we need far more. And when we are, there is a myth that when we are old, we really need less sleep. What happens is, because of the medical problems that we have and some other issues, we tend to have a less consolidated sleep.
Let's go through some misconceptions. Since you brought them up, I'm going to take advantage and show our viewers some of them. People need less sleep with age. We just talked about that. Everyone needs 8 hours.
We know it's not true.
Not true. You can catch up on sleep.
Yes, you create something that is called a sleep debt. If you can, for example, you need 8 hours and you are only sleeping 6. So you are going to create, it's like having a credit card. You start getting a debt. And when you go during the weekend, for example, you can sleep like those extra hours.
More.
And you can make up for some of the sleep, but it's not optimal and it's not ideal. But then you can establish on a sleep debt and then you can pay it off when you can. But there is a question that my patients ask me all the time. how many hours do I have to sleep? Because there are all these myths. And there is a very simple strategy. If you are on vacation and you can sleep as many hours as you wish, what you do is you go to bed at the time that you want to go to bed.
Okay.
You get out of bed whenever you feel that you are rested for about 5 to 6 days.
And that's
and
how...
you take an average.
Ah.
Usually that tells how many hours you need.
There you go.
Then you have to build your life about it. People are trying to sleep around their schedule and around their life. No.
No.
We need to build our lives about our sleep routine and our sleep patterns.
That's great. Okay, a couple more myths I want to show our viewers. So let's take the next one, which is watching TV helps. Doctor?
No, it definitely not, because for many reasons. One, it interferes with your sleep. Sometimes you can go into stages where you are like half awake, half asleep, and you're still being aware of what is happening. Second, the light that is produced by the TV tells the brain that there is daylight out there, that you're not supposed to be sleeping. So a stimulation at night, and particularly television, is bad. And you can incorporate it in your dreams. Just imagine you're watching the news, you're sleeping, and suddenly they start talking about an accident or a tragedy, and then you will
or political
it.
stuff.
It's horrible.
That's just enough. Oh my
exactly.
gosh, everything is political. Exercising at night helps.
Exercise is always good, except that about 4 hours prior to sleep, you shouldn't exercise.
I
and
agree.
the reason is very clear.
Endorphins.
And temperature. One of the things that happen to our bodies when we go into deep sleep is that there is a dip in our body temperature. So if you exercise, you increase the core body temperature. So it's going to take longer for you to fall asleep.
Of course,
because you can increase it for 1 degree, half a degree, and then you have to go that. That's why when your room is cool and the temperature is low, you tend to fall asleep easier. They even have some devices that you put in your head that cool your scalp, and that can induce sleep. So you don't want to warm up before going to bed.
All right, this is a big one. I want to hear what you have to say. Drinking warm milk or tea, or as my mom would say, tómate un poquito de tilo y te vas a dormir. And I'm like, what, Mom?
That's not really bad.
No.
But the problem is if you have reflux, or you have some...
By the way, tilo is tea, so it's the same thing. Tilo and tea are the same thing.
It's tea without caffeine.
Right.
So what happens is if you have like a little bit of milk, it's not going to really harm you if you don't have an associated gastrointestinal problem. We tell people that you shouldn't eat like about 2 hours prior to going to bed, and if you're going to eat, you should eat only a small bite. But you don't want to have a full stomach, because that can give you reflux, it can interfere with sleep. There is something that people can do sometimes that can help, is to take like an apple, you divide it like in four pieces, and you boil it, and then you get a normal chemical that is there. It's called a tryptophan. It's an amino acid that induces a very physiological sleep. That's the same thing that you have in Turkey, and that's what after a heavy meal during Thanksgiving, people are so sleepy, because you get a lot of tryptophan. And apples have a lot of tryptophan.
Oh, look at that. I never heard of that. Okay, and the last one was alcohol. It helps.
Horrible. Alcohol induces sleep, but it's not a physiological sleep. That's not the sleep that you want to have. Alcohol induces a sleep that is pharmacologically induced. And the other problem is that it makes all the sleep disorders worse. So if you have tendency to have obstructive sleep apnea, alcohol can put you in that non-being able to breathe period, and it can distort the whole cycle. So never. It's okay to drink with your meal at night,
like a glass of wine,
in the social context with your meal, but never has a sleeping aid.
All right, but a glass of wine with dinner.
With dinner is perfect, but it has to be good wine.
Red or white?
Right.
Okay. You'll give me a couple of good ones in the break, because I'm a wine girl. All right, we're going to take a quick break. Remember, wine, good wine, not that cheapo $5 bottle. Coming up, a tough night's sleep has its obvious drawbacks. So what's the effect? Does it have it on your body, especially over time? We're going to get the answers from the doctor. He's so charming. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for our charming doctor, please call us using the toll-free number 855-796-4475, and be sure to visit our website, allhealthtv.com, where you can watch a live stream of the show and watch previous videos. We'll be right back.
Hi, I'm Luis Fonsi, and I'm here at the Miami Health Channel studios with the Thanks and Giving campaign from St. Jude Children's Research Hospital. I hope you can become involved, and I hope you can donate to save lives. To do so, please visit stjude.org. Happy holidays.
A brain aneurysm doesn't care that you have important meetings. It doesn't care that you have to drop your daughter off at ballet and your son off at soccer practice. So if you suddenly experience the worst headache of your life, sharp pain behind your eye, and blurry vision, seek immediate emergency care. The Lisa Calagrassi Foundation, shedding light on brain aneurysms. Learn more at lisafoundation.org.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer.
Enter your family history, learn your risk, talk to your doctor. Visit knowbrca.org to find out more.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Carlos Ramirez-Mejia, a neurologist at the Baptist Health Neuroscience Center. I apologize for that. We want to know your questions, so please call in using the toll-free number right there, 855-796-4475. We would love to hear from you. Now, there's no doubt, we know sleep is good for you, but what does it mean when we don't sleep at certain times? So, doctor, let's talk about that circadian rhythm that we hear a lot about. What is it? And explain that to our viewers if possible.
Okay. Remember when I was mentioning that we haven't evolved a lot as biological creatures that need sleep. So sleep is a very primitive function, and it has been like that for thousands of years, hundreds of thousands of years. So we are subject to the sunlight. We are subject to the changes in the magnetism of the planet. We are changed to all the things that are around us, just like the birds or any other animal. We think we're different where we are not. So we depend on the exposure to light and to darkness to regulate our cycles of sleep. And when we are born with blue eyes or green eyes or brown eyes. And the same way, we are born with certain tendencies towards circadian rhythm. So there are individuals that are far more productive and they are more active in the morning.
That's me.
Yeah. So those people are at the peak of intellectual functioning.
Oh.
Usually these people trying to wake up earlier, and they want to conquer the world when they get up and they take a shower singing. They're horrible.
I do that too.
And then they go and they are like so enthusiastic and so happy in the morning. I don't know how can they do it.
I like the sunrise. I don't like the sunset.
So these people are like that. So this biological, it's difficult to get that person to sleep in the morning and to sleep late because that person is in the peak of the performance. If you know that, because everything is about knowing yourself, if you know that, you need to schedule all your interviews in the morning. You need to try to get the most difficult classes in the morning. You should try to schedule all those things. Now, there are people that their performance is better in the afternoon and in the evening. Like, for example, I am better at that time.
Okay.
So what happens is, in the morning, I shouldn't have my heavy intellectual activities, and I should leave it for the afternoon. But that's biologically determined. So as we age, our sleep cycles change. The young people tend to want to be up until 2 or 3 in the morning, and they have difficulties getting out of bed in the morning, like at 7 or 8. It's a struggle. The families, they feel like pouring out water on them to get them out of bed. And that is it's a biological tendency that needs to be worked on, because these people, society doesn't work like that, the universities don't work like that.
Of course like that.
So that's part of the circadian rhythms, and it's a circadian rhythm disorder for some people, and we need to treat it. There are simple ways that we do. We do like a little bit of melatonin at the beginning of the evening.
Oh, okay.
We expose them to light in the morning, but elderly people go to the opposite. They tend to go to bed early, which is another change in the circadian rhythm, and it can become a
So it does change
condition.
over time as well.
So you go to bed early, and then they are up at 4 or 5 in the morning.
Exactly.
And they don't have insomnia. They just have a disorder of the circadian rhythm. So, and we can disrupt that. We can disrupt that when we take melatonin as a sleeping aid, which is not something that we advise, because if you take that, you disrupt the whole system. You should try to to start listening to your body and try to accommodate to the circadian rhythm and your own internal clock.
What do you think about naps? Do they help? Are they good, bad?
Naps are fantastic. And I think in my culture, we nap, in our grandparents, our relatives from Europe, they used to nap during 2 hours in the middle of the day.
In the middle of the day, yes.
That's doable here. When I talk to these executives for big corporations, these very progressive companies, they tell me how can we improve the quality of life of our employees. And one of the things that I talk is about the Nappuccino.
The Nappuccino.
Yes,
How
Nappuccino.
cute is that?
Yeah.
Did you make that up?
No, this is a great strategy. Let me tell you how it works. In the middle of the day, you take a period of time for yourself and for sleeping. So you get, in some of the companies, they have like little drones, they have like little areas, like little cubicles where you can do it. Sometimes you can do it in your office just by being comfortable. And you eliminate all the stimulation around you, and you drink a cup of coffee. Has to be good coffee, hopefully Colombian coffee. And then you drink it. It's heavy in caffeine.
Okay.
You fall asleep, you take your nap, and in 20 minutes or 25 minutes, the caffeine kicks in. So when you wake up, you get the caffeine rush. That increases your production by 20 to 30%.
Look at that.
Not only because your brain rested,
A Nappuccino.
but because you got the kick of the caffeine that was strategically placed. But there is a problem. If you sleep more than 25 minutes, your body thinks that you are going to sleep for a full night.
So it's like a cat nap.
So in that moment, if you extend your sleep over 25 minutes, you're going to be
Groggy,
foggy.
pesada.
Exactly. You're going to be a
Bad
horrible
mood.
person to be.
Okay, so it's a quickie.
You need to do it like no more than 25 minutes, and the brain loves it, improves intellectual performance, makes you a better person, a better coworker, and your production goes up.
Well, this is a live show, so I can't do that right now. All right, poor sleep can affect a lot of your overall health. We have a graphic to show our viewers. Let's take this graphic, and you can see just the effects. These are all the risks. Decrease in attention, doctor, we chimed in on that. Memory is affected. Impaired reasoning skills, really important to have all day, especially driving like we talked about. Mm-hmm. Increased tendency for errors.
Yes, and a lot of medical errors occur in the emergency rooms when physicians and health workers are so fatigued that they cannot think straight. Our level of tolerance becomes, I remember when I was in the hospital, at the beginning of the shift, I was so nice and lovely and pleasant, and after 24 hours, I was not horrible, but I was not as nice as I was at the beginning. And it is because the sleep deprivation is horrible, it is really bad for you.
Exactly, and the other one is lower reaction time, of course.
Yes, and that affects pilots, it affects you when you are taking a test, it affects you when you are driving, and it has an effect in your emotions. It makes you less tolerant. So your fuse becomes like this, you become, and then you have to revisit the whole situation later on and said, why was I like that? And it's not because you are a mean person, it's because you were sleep deprived.
You're cranky, exactly. Actually, every time before I get into a flight, I always look into the cockpit and I tell the captain, did you sleep good? Are you happy? How do you feel today? Before I go sit down. All right, we have another graphic to show our viewers about basically the risk for mental health and emotional concerns as well if you don't get enough sleep. Depression, doctor, big.
Yeah, it's big because during the night we produce all these neurotransmitters that are needed for optimal function of the brain, intellectual and emotional. So if you are not sleeping well, your depression is going to get worse. It's not inducing depression, but it will make it worse. Your anxiety increases. Just imagine you don't feel rested. You feel that your night was not appropriate. And there is something that happens at night called the racing thoughts. When we don't sleep well, we start thinking about all the problems. And everything looks worse.
Worse, yes.
Everything at night is like 100 times worse than it is during the day.
You're absolutely right.
And the world is collapsing.
Yes.
Everything is horrible. And that's part of and it builds anxiety. And again, decreased social functioning, meaning that you're not going to be charming, you're not going to be as nice. And when you are at night, you start thinking about horrible things,
The world is
horrible
ending.
outcomes.
Yeah.
So that's when people have tendency to have suicidal thoughts. Those can come during the nighttime, and it's not a good thing.
No, it's not.
It can lead to a lot of problems.
Quickly go into the risk for our physical health. We have another graphic to show you when you're sleep deprived. This can happen over a long period of time, of course. High blood pressure, doctor?
Yes. A lot of people tell me my blood pressure is perfect, and the blood pressure is perfect when I measure it. When they are, for example, at night without being able to sleep, or they have a sleep apnea, the blood pressure can go up to the roof.
It does,
So
yes.
during the day, it's like 125/80, and the doctor says you're doing the right things. When you look at night, it's 220/140/50. And a lot of deaths occur at the beginning of the day, at 6 in the morning, 7 in the morning, because you are paying the price for the high blood pressure that you had during the night. And almost nobody gets the blood pressure measured at 4 o'clock in the morning. So we recommend everybody to address the sleep issues, obstructive sleep apnea or insomnia or some other medical problem that are associated with the sleep, to improve your numbers. Your diabetes is more difficult to control. And the reason why the diabetes is more difficult to control is because you produce all the stress hormones, and the stress hormones increase your blood sugars. And another thing is, we have two hormones, one that tells us eat and one that tells us you ate enough. During the night, when you don't sleep, the one that says eat goes up, and the one that says you ate enough comes down. So sometimes people need to eat at night, or when they wake up in the morning, they have a severe appetite. So that can be affected. And if you have diabetes, you don't want to eat more than you are supposed to. And if you want to be fit, you don't want to eat more than you are supposed to. You can get a condition that it has no good outcome, which is there's no cure for it and it's lethal, which is called the pulmonary hypertension. You can get arrhythmias that can be associated with stroke and sudden death. So a lot of things can happen during the night that are not desirable if you don't sleep. And remember, sleep is such a primitive and biological function that we make it more difficult than it is. We are supposed to go into the very natural process, because you can sleep by two mechanisms. One of them is you go into the process of sleeping because you need to sleep, and your body produces all the chemicals and the hormones and put you into a very nice and restful sleep. But you can fall asleep because you are extremely tired. That's when you collapse. And that's how people are sleeping now. And that sleeping because you are so tired and you collapse is not physiological, it's not normal, and you don't get the benefits that you get from a normal, well-consolidated, naturally induced sleep.
Unfortunately, I think that's most of society today with all the stress we're under. We're like the Energizer bunnies, and then boof, we collapse. All right, doctor, quick break. Do you know the difference between sleep deprivation and a sleep disorder? We will talk about the most commonly treated sleep disorder when we come back. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for the doctor, please call us using the toll-free number right there, 855-796-4475, or just check out our website, allhealthtv.com. We'll be right back.
C stands for courage, collaboration, compassion, and sometimes even cuddly. At Miami Cancer Institute, C also stands for Cure, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
Hi, this is Terry Bradshaw here to remind you that rheumatic diseases like rheumatoid arthritis and lupus are important to know about. 1 in 4 Americans has a rheumatic disease, and I'm one of them. And if you're like me, folks, you don't have time for arthritis to slow you down. Between being a sportscaster, making movies, and checking things off my honey-do list, I'm busier now than I've ever been. Flare-ups aren't fun, which is why I follow the orders of my rheumatologist. Eating healthy, staying active, not smoking, taking my meds, and managing my stress all keep me going. I've also committed to my health by taking the American College of Rheumatology's pledge to live well with rheumatic disease, and you should too. Know the signs, get help, and take care of yourself, folks. Visit simpletask.org to take the pledge to live well.
Everyone deserves a decent place to live.
Everyone.
When a future homeowner partners with Habitat for Humanity to build or improve a home, they build a better future for themselves and their families.
For my family.
For my family.
For my family.
With a little help, we all have the potential to stand on our own.
Potential.
Visit Habitat.org to provide help to families like these today.
Welcome back to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Carlos Ramirez-Mejia, a neurologist at Baptist Health Neuroscience Center. If you have a question for the doctor, please call us using the toll-free number right there, 855-796-4475. We certainly would love to hear from you. So sleep disorders can make it hard for people to go to sleep, stay asleep, or even breathe while sleeping. So, doctor, we know the effects of no sleep is not good. We have a graphic of several sleep disorders that I want to go through. I hear a lot of people, a lot of my friends saying, oh my gosh, Olga, I have so much insomnia. There's number one.
Insomnia is the number one reason why patients see the doctor for sleep disorders, and the majority of times is because you lose the natural mechanisms of sleep and you have inappropriate associations with sleep. It's one of the most difficult conditions that we can treat, and one of the problems is that everybody wants a medication, but all the studies shows that
quick fix.
Medications don't really work as well as changing in behavior and to doing some kind of form of psychological intervention like meditation or some other techniques. But everybody wants to have a prescription, and prescriptions don't really work for the short term, but it's not a fix. So we need to do more like education regarding the treatment of insomnia by non-pharmacological means. And
I was reading here, according to the sleep education, that as many as 35% of adults complain about insomnia. Wow, that's a lot of people. Hypersomnia, doctor?
Hypersomnia is when people have difficulty staying awake during the day, and we have two different kinds of hypersomnias. The ones that are associated with a sleep deprivation of a sleep disorder that happens at night, and the other hypersomnias are for conditions like narcolepsy. Regardless of the number of hours that person slept the night before, they cannot stay awake, and they can have difficulties with concentration. It's underdiagnosed, and it's a condition that can be relatively easy to treat, and is quite disabling.
Okay, let's go through the third one, sleep breathing disorders. I'm assuming that's maybe like snoring? Yeah,
the sleep breathing disorders is when your airway collapses in the middle of the night. What happens is when we are in a deep sleep and we are dreaming, our body produces a paralysis of all our muscles. If that paralysis doesn't occur, you will do whatever you are dreaming, because the brain, when you are dreaming, you think that is happening, and the brain thinks the same thing. So if the brain thinks that you are doing whatever you are dreaming about. So to protect us from injury or from doing the things that we are dreaming about, we get paralyzed. When we get paralyzed, all our muscles become really soft and relaxed, and the airway tends to collapse. If you are on the top of that, obese, and you have a short neck, and there are some other like anatomical predispositions, then you can have obstructive sleep apnea. And that is like it's like if somebody is putting your head in a bucket with water, and every time that you are ready to suffocate, they take your head out, then you breathe, and then they put you back in there. So it's like it's happening all night, like waterboarding all night.
Exactly.
So that is horrible for the brain. It deprives the brain of oxygen, and it can really, even sometimes, lead to death.
Oh, wow, that's really
And
serious.
one of the manifestations is snoring. So that's why if you snore, you need to talk to your doctor to see if you are snoring because you have something with your deviated septum or something, or if you are having obstructive sleep apnea that has the potential to be lethal.
All right, let's go to the next one, circadian rhythm disorders, doctor.
And the circadian rhythm disorders, the ones that happen to people, for example, that are working in schedules that are not predictable or they are not regular. The ones that, for example, firemen, nurses, doctors, TV anchors, sometimes you have to work at night, sometimes you have to work during the day, and that can disrupt your natural cycles. And the other ones that I was mentioning before, in young people, when they try to go to bed like at 2 in the morning and then get up at like a 8 or 9, so you move your cycle, and it becomes every time more and worse. Sometimes they get to the point they have to go to bed at 4 in the morning. And the elderly people that tend to go to bed very early. And the other is the jet lag. That's the one that happens when we travel. So those are the circadian rhythms, and sometimes we can fix it ourselves.
Right, get it back on track.
Get on track, but many times we need the help of a professional.
Okay, there was another one called parasomnias.
Yep. Parasomnias is when you have abnormal behaviors during the night. When you are asleep, you are supposed to lay in bed. You move all the time, but you have little movements just to prevent you from suffering injuries, you know. You are like sleeping in one position, you can harm a nerve, you can have the muscles. So you're moving, and you move multiple times during the night. But overall, you seem to be like quiet and you seem to be still.
Right, you're not on the other side of the bed.
There are people that have what's called the parasomnias. One is, for example, sleepwalking. People that get out of bed and they start walking around. There is another parasomnia that is called the night terrors. And the night terrors, what happens to children very often, and it happens more in certain families, is when they wake up in at the beginning of the night screaming and yelling, and it's like the most horrifying scream. You think like they are dying, like the screams in the movies.
Right.
And then when the parents go to the room and they wake up, the kid wakes up, the kid doesn't remember what happened. So only the parents get scared. So that's the night terrors. We have something called the REM disorder, which is when you do what you are dreaming about. So the system that paralyzes you doesn't work. So if you are dreaming that you are running, you will run. And you will run against a wall. Or if you feel that you are fighting somebody, you start kicking your wife or your bed partner, and it is a very distressing and it's a horrible feeling. So sometimes this is the first manifestation of a more serious neurological problem, like dementia or some other forms of neurodegenerative diseases that need attention. So that's called the REM disorder. So we have sometimes automatisms at night when people do things without remembering it, and it's usually induced by medications. Like people take medications for sleeping aids, like Ambien and things like that, and it can disconnect them from reality. I had a patient that used to cook full meals at night, clean the kitchen, put all the dishes away, go to bed, wake up in the morning, no memory of it.
No.
She goes opens the refrigerator and says, what happened? Somebody was here last night. And they think that somebody came into the room. They forget.
Oh my goodness.
And it's induced by medications. And some of the medications that are prescribed very often.
All right, we have wow, that's interesting. We have a caller on the phone. His name is Frank from Stewart. Frank, are you there?
Yes, I'm here.
Hey, Frank, what's your question, sweetheart?
Yes, my question to the doctor is I was taking Topamate for tremors, and I had cancer, and she said that they would not give me any more of the Topamate because I have the blood thinners that I'm taking. But on the other hand, they also said to me that the Topamate was giving me stones, and I had 2 operations to remove stones. What do I do at this point for tremors?
Okay, topiramate is a medication that is used for epilepsy, is used for problems with tremor, and is used for prevention of migraines. It's a great medication, it's safe, but unfortunately it's associated with kidney stones. And that is a contraindication for this medication. So it's probably what happens to you, you can add. There are some other medications that you can take for tremor. If it's Parkinsonian tremor, you can take some of the classic medications for Parkinson's in small amounts, but you can take other medications like Inderal. There are some other medications that are specific for tremor that might be helpful and don't have the side effects and the issues of topiramate.
All right, Frank, thank you so much for calling into the Health Channel, and hopefully you'll feel better. You know, when you talked about the Ambien, which is obviously a medication that people use to get sleep, I've often wondered, or feared, I should say, that these people can get hooked on it too. Do you find that happens a lot?
Yes, it happens, because one of the things is you're eliminating the natural cycles and process of sleep.
And the body's not dependent on it.
Exactly. Now you are inducing a many times non-physiological, and remember, these medications are called hypnotics. And the reason why they're called hypnotics is because they induce like a trance-like period. So elderly people, and elderly people, it tends to change. For me, it used to be people in the 40s, 60s. Right now, it's like in the 80s, what people I call elderly.
Oh, absolutely,
and
90s, 90s.
And I think in 5 years, it's going to be like people in the 100s.
100, yes. So, I hope I get there.
Yes. So the problem is that they can get out of bed, and they have an increased risk of falls and injuries as a result of the Ambien. So these medications are very, very dangerous. You can take it sometimes for short periods of, like for a week or 2 weeks, sometimes for a month, for very specific problems. But the chronic use of these medications can lead to a lot of problems, particularly when you mix it with alcohol. Remember, one of the Kennedys, for example, was a senator, was driving around.
I was just thinking of that.
Yeah, he was driving around D.C. in his car and all that, completely disconnected. And it's because he drank, not because he was Irish, but he drank while he was taking this medication, and he became a kind of it was like a robot, and he just found himself surrounded by police officers. There was a defense of a man who killed his mother-in-law because he took Ambien.
Are you kidding?
Yes.
That was his defense?
That was his defense, and I think he got away with it, but I don't want to give anybody ideas.
Oh my, he got away with it?
I think so.
I'm gonna Google that one. That's crazy. All right, doctor, thank you. So much great information. I love this. Coming up, no matter what keeps you up, we will have some tips for a better night's sleep. So stay with us. You're watching the Health Channel. All health, all the time on South Florida PBS. If you have a question for the doctor, please use the toll-free number, 855-796-4475. Also visit our website. It's really fantastic, allhealthtv.com. Everything there is for you. You can watch a live stream of the Health Channel and watch videos from previous episodes. We're back in 2 minutes. Stay with us.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T-cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
You can try to ignore it, but the problem is everywhere. Every instinct says don't look, but sooner or later we must, and our reaction is only natural. Mice contaminate food and transmit disease. Termites cost billions of dollars in property damage each year. And cockroaches can trigger asthma attacks and spread salmonella. Trust your instincts. Learn more about how to protect your family at pestworld.org.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge and your help, we can save them all.
We develop quality citizens who keep our core, our country, and our communities side by side on the winning side. Not for glory, but for honor. For a code that isn't written or spoken, but lived. It's what we do. It's who we are. It's the battle cry of our fighting spirit. Battles won. See all the battles Marines fight to win at Marines.com.
Welcome to the Health Channel, All Health All the Time. I'm Olga Villaverde, and with us is Dr. Carlos Ramirez-Mejia, a neurologist at the Baptist Health Neuroscience Center. If you have a question, please call us using the toll-free number, just like Frank did, 855-796-4475. All right, so do you know the best way to get a good night's sleep? A few weeks ago, I had the pleasure of speaking with the medical director of the Galloway Sleep Center, who gave us a few tips. Take a look. Let's talk about those bedtime rituals, and do you have any other ones that you'd like to add that are good?
Well, I think it's very important for the bedroom environment to be conducive to good sleep. So there you want a dark room, a cool room, sufficiently cool without being overly cold, and a quiet room. That's what affects women's sleep so much if the husband snores. The room needs to be quiet enough. And if people are having problems sleeping, we encourage them not to have the kids co-sleep or have their pets in the bed with them, so that the bedroom environment is conducive.
And speaking of bedroom environment, I'm going to be very PC about this, but what about, before sleep?
That's entirely permissible and conducive to good sleep.
Like, what about? All righty. And naps during the day, do you like those?
I think that's very individual, of course. Some people, if they're a little bit tired in the afternoon, and that's our natural tendency with our circadian rhythm, to be a little tired in the afternoon, there's nothing wrong with a nap. We encourage naps not to be too long,
right?
20 to 30 minutes, and certainly not close to bedtime when it might interfere with going to sleep at night. If people are having trouble falling asleep at night, then they should not be napping.
Okay, that just destroys me if I even sleep 15 minutes and boom, I'm wide awake at night. Good mattress, important?
A mattress is very important, but it's not one size fits all. Some people want a hard mattress, some people want a soft mattress. You have to really try it out.
Yes. And pillow? What about a pillow?
A pillow should provide comfort.
Right, again, whatever works for you.
Yes,
okay.
Especially depending on what kind of position you sleep in. Some people sleep face down or on their side. They don't need as much of a pillow to raise the head as someone who might sleep on their back.
So that was good that we clarified it, because when you said not exercise before sleep, I thought about that question again regarding having a little bit of fun, vodio dodo, however you want to say it, whatever, sex. So that's good. That's healthy.
Yes, what happens is the only two things that you can do in bed is sex and sleep. And the reason is because the brain needs to have a conditioning and association between bed and sleep. Anything that changes the association between bed and sleep is bad. For example, if you go into bed and you watch television, you lost the association. The brain doesn't know when you go to bed if you're going to go to bed because you're going to sleep or because you're going to watch television. If you answer phone calls, if you read in bed, if you use an iPad, if you have conversations, you lose the association. Well, you remember, it's a very primitive thing. So the way to do it is you create the stage conducive to sleep, meaning you lower the temperature of the house, you dim the lights, you decrease environmental stimuli, and then you go into your regular routine, brushing your teeth, putting your pajamas or getting naked, whatever you prefer. And then when you go to bed and you put your head on the pillow, the brain knows that there is only one thing left that activity is for, and it will makes you sleep. Having sex, of course, relaxes.
Yeah,
and
because I was going to say, you put your head on
and
the
it helps.
pillow, your brain knows, and then your husband's going,
It doesn't matter.
Sweetie.
That is an activity that's permissive, and it's actually associated, and it's associated with a better quality of sleep.
Look at that.
So it is okay. But remember, bed.
Two things.
Activity is limited to those two things.
Okay.
And that's why if you cannot sleep, you need to get out of bed, go to another area of the house, like the living room, sit there, listen to some music, read a little bit.
So get out of the bed.
Until you are, again, with the need of a sleep, and then you return to the bed.
Because it'll get you more antsy to stay in bed and not be able to sleep.
Because if you stay in bed without sleeping, you lose the association. That means I can be in bed for something different than sleep, and you don't want that.
Okay. National Institutes has some other tips for a good rest. The first one, doctor, is, and we got to go through these quickly because we're nearing the end of the show, although it's been such a pleasure this whole hour with you. Relax. That's really hard for me to do. So what are your, what's your advice for relaxing?
Relaxation, one of the best techniques for relaxation before sleep is mindfulness. Mindfulness is when you live in the present. That means you start living in the present, you start thinking about the good things that you have, you try not to think about the things that happened before, because you cannot change those. You have no control over the future, so you start getting more in contact with your present. You start doing like some relaxation. You start thinking about things like, I don't have pain, I am comfortable, I am in a nice bed, everything is looking up for me. The challenges for tomorrow will be faced tomorrow, not tonight.
Today.
And then when you start getting into the mindset, you can go into a very nice and physiological sleep.
What about breathing? Like they say to breathe in.
Breathing helps.
Breathe out.
Breathing helps. No, breathing helps because it's part of the relaxation techniques, and it's taking you away from the bad thoughts so they interfere with the sleep.
Essential oils or lavenders? No, you don't buy them.
Actually, you don't have to pollute your environment because many of those are chemicals that are not desirable. They are like acetone with smells. Sometimes the natural ones that are like plant derivatives can help you disconnect, and if you associate them. For example, people that like massages and all that, they always associate the smell of these, for example, oils with something pleasurable. That can help them. So it is it works for them. It works for them, and it may work for you, but it's not necessary.
There are some apps that they say helps you go to sleep, where you press it and there's some music. Yes or no?
Actually, it helps people that they feel that they have more control, like very young people that love to have electronics controlling their lives. So that's like giving them this application control over their lives, and they feel that it's going to help. But I think nothing beats the natural techniques and just having positive associations with sleep.
Can having a good dream, like you married George Clooney and he picked you up. Do you know who George Clooney is?
Yes, of course.
Okay. And he asked you to marry you, and you have a mansion and 6 children with him. Or you won the lotto. When you have a good dream, is that kind of like a good night's rest?
The first thing that you have to remember is that we dream about 25% of the time.
Oh, that's it.
Sleep, 25. And if you are awakened during REM, which is the period where you are sleeping, you remember the dream. If you wake up after going through your whole normal sleep, you shouldn't remember. So many times, remembering your dreams, good or bad, is a sign that you are sleep deprived or you are not sleeping well.
Fantastic.
So it's not necessary to remember them.
All right. Well, having a bad dream, I'm sure, is not a good night's rest anyway. All right. So I learned a lot, but the most important thing, I think the takeaway is, how many hours of sleep, doctor, do you suggest a night?
Everybody's different.
I know.
You should use my formula, but it should be no less than 6.
No less than 6. 7 is good. 7 to 8.
For the majority of people, 7 to 8 is sufficient.
Okay. And the bed is only for?
Sex and sleep.
Right.
And you're lucky.
And in that order. And then, of course, we talked about wine at the beginning. Favorite wine you want to give me?
Shiraz.
Shiraz. Okay.
It's a good wine.
Shiraz.
It's a little fruity, but it's full, better flu flavor.
And what else did I learn from you? Oh, yes, drink Colombian coffee. That's what he likes because he's from Colombia.
Yes.
Doctor.
The best coffee in the world.
Un placer. Thank you so much. Please come back. A joy to have you. All right, that's all the time we have. Please be sure to join us next time on the Health Channel, All Health All the Time on South Florida PBS. Follow us on social media at All Health TV if you like social media, or just go to our website, allhealthtv.com, where you can watch a live stream of the Health Channel, watch videos from previous episodes. I'm Olga Villaverde. I hope you get a great night's rest tonight. Sweet dreams, marry George Clooney, win the lotto, whatever you want. I'll see you next time. Take care. You were...